Thank you for joining us today, and thank you to the Brookfield Residential YMCA in Seaton for hosting us. My name is Matt Jones, and I am the MLA for Calgary Southeast. I am joined today by my colleague Rebecca Schultz, Minister of Children's Services, and Dr. Kelly Schwartz, Associate Professor at the University of Calgary's School of Applied Psychology. We are here today to announce the completion of the work of the Child and Youth Wellbeing Review Panel and to reaffirm the Government of Alberta's commitment to a well-informed and research-based action plan to support our children and youth. The last 2 years have been hard for everyone as we work to protect our most vulnerable and our healthcare system while adapting to constant change. Unfortunately, the lives of our children and youth have and continue at times to be disrupted. That's why last May, Alberta's government launched the Child and Youth Wellbeing Review to hear how the pandemic was specifically affecting our young people and to find out how we can provide further supports and resources to families. The Child and Youth Wellbeing Review Panel has consulted experts and heard from over 10,000 Albertans, including parents, educators, healthcare professionals, and even youth directly, to assess pandemic-related impacts on young Albertans. I'm pleased to share that the panel has now completed their report, which lays out not only what we heard, but recommendations for government to work to address any impacts. What we have learned throughout this review will guide government as we focus on the well-being of children and youth and will help to ensure that the right supports are in place to secure a bright future for them. It has been an honor to be part of this review, and I look forward to the work ahead. I will now turn the mic over to Minister Rebecca Schultz.
Just a touch shorter than MLA Jones here. All right. Well, first of all, I just want to say thank you to MLA Jones. We know that this pandemic has not been easy on anyone, and I think it's fair to say that it's been especially hard on kids and youth. And MLA Jones felt really strongly about this and was really the driving force behind this panel and this very important work. We know that the necessary measures we took to protect public health have affected all of the places and activities that children and youth depend on to give their lives structure, meaning, and joy. And that's why I think it's so fitting that we're here today at the YMCA, where we can see kids swimming and skating and taking part in preschool and childcare in a place that also really does everything they can every single day to keep kids and their families safe and healthy while still connecting with other people and staying active. We also heard over the last number of months that at-risk children and youth have maybe been the most hardest hit, sometimes dealing with other challenges when it comes to food insecurity, housing, parents who may be facing their own struggles as it relates to the economic crisis that we've seen here in Alberta over the last number of months as well. I would say that as both the Minister of Children's Services and as a parent, I am so incredibly grateful for the panel and for their time and all of their hard work and effort on behalf of Alberta's youngest and very important citizens. As one of the co-chairs, it has been a privilege to witness the amazing work that you've done over the last number of months. You've combed through endless amounts of data and listened to nearly 10,000 Albertans as they shared their unique and diverse and very important perspectives. You've put together a comprehensive report that will help us learn from what isn't working well and focus on what is, as well as effective and targeted supports for children, youth, and their families. This panel was made up of some incredible Albertans who have dedicated their lives and careers to helping young people thrive. Some of our panelists were not able to be here with us today, but on behalf of the entire government of Alberta, I truly want to thank our panelist, Dr. Kelly Schwartz, who is with us today and we'll hear from in just a moment, as well as Jennifer Turner, Carol Carafel-Brzezicki, Dana Fulweiler, and Nancy Mannix. Now that this report is complete, the next step is to review the results and create an action plan guided by the panel's very specific recommendations. We'll work with all possible government ministries to look at the resources we have now to see if we can make them more efficient, more effective, and in the right place at the right time for kids and families who need it. The pandemic continues to be ongoing, as we all know, and I know we will keep learning about what children and youth need most and how we can best support them. But our kids need help right now, which means our strategy will focus on the immediate action without tying our hands for the future. Our understanding of how to handle COVID-19 is still evolving, but reviews like this have given us vital insight on steps we can take to support our youngest citizens. Along with my government colleagues, I am looking forward to getting to work on how we can all come together to serve young people better, and I do want to now invite Dr. Schwartz to tell us more about this work and what the panel has really found.
All right, good morning to you all. Thank you, Minister Schultz. I am here this morning representing a strong volunteer panel that was assembled for this very critical task. And I'm grateful that I've been part of this opportunity to hear from young people, from caregivers, educators, and health professionals on how youth are processing their pandemic-related experiences. Our panel gathered information for our review in a number of ways, including online surveys, on many matters related to adults and children and youth under the age of 19. We also completed 6 telephone town halls and 16 virtual roundtable sessions that allowed us to hear a broad range of personal stories and stakeholder perspectives. As we analyzed responses from thousands of participants across the province, we saw the reality of the effects of the pandemic on different age groups and different segments of our population. For example, we heard how preschool children were often going without the social interactions important for their social development and their preschool readiness, and how parents were working from home and dealing with multiple demands on their time in addition to doing their best as parents. For school-age kids, multiple moves to and from online learning was a common challenge. Not only did kids have to change how they socialized with their peers, but they were also dealing with the impacts of increased screen time and decreased physical activity. Now, we know that good mental health and good physical health are highly related, and youth reported in our survey that they felt more fatigued, were eating less nutritiously, and were leading less active lifestyles. While the pandemic has been difficult for all young people, we did notice that some vulnerable groups were hardest hit. Many children, particularly those in rural and northern communities, were facing additional problems related to housing issues, food insecurity, a lack of access to technology to help with online learning, and caregivers who were stretched beyond their limits. At the same time, we heard numerous stories of how youth and families demonstrated extraordinary resiliency, and how schools and community services work together to find creative ways to do more with less and to share resources. This review has confirmed the need for both new and existing targeted, community-based interventions that nurture physical, mental, and spiritual health in children and youth. The recommendations of our panel reflect a collective spirit for positive change in how and where we can best support children and families moving forward. And like you, I am eager to see how the action plan takes shape in the very near future. Thank you.
Thanks, everyone. That concludes the formal remarks. We're going to move to our Q&A portion. I ask that you limit yourselves to one question and one follow-up. For those on the line that have a question, please press *1 to get into the queue. With that, operator, can you please put through the first caller?
Bill Kaufman, Post Media. I ask that you limit yourself to one question and one follow-up. For those on the line that have a question, please *1 get with that, operator. Bill, your line is open. You may.
Yes, hi. Hello. I'm just wondering what are some of the hello. I'm just wondering what are some of the recommendations are the prime recommendations you've got here to counteract some of these issues we're seeing with children and how the pandemic has impacted them?
Hi there, it's Kelly. I can address some of that. So, as Minister Schultz said, we had the great challenge of working through thousands of online responses, all of our roundtable discussions, and we tried to distill that into recommendations that we thought were not only creative and new, but would lead to really substantial change. A couple of them, of course, that stand out to me, my background is in school psychology and working with kids who have social emotional learning, cognitive needs, and the pandemic was particularly rough on those kids as well. We heard from our province that we need to not only enhance the availability of resources, but also the accessibility of those resources, and to enhance kind of the collaboration between those two. That's why I use that term, both existing and new resources that we hope will support children and families in the province. We know that there are excellent things happening for kids and families. The question is, how do we make that known to them? How do we take down the barriers of access for kids and families? And of course, again, from my background in schools, we see schools as serving as kind of an enhanced hub for some of those services. And that'll be the challenge moving forward, is how we best equip schools, how we best make sure there are trained professionals to work with the kids and youth that need that. And so that's addressed in our recommendations.
Bill, did you have a follow-up?
Sure. What would you say or can you point to some of the most severe impacts the pandemic has had on younger members of our society? Do you have any examples of some of the really, the most severe impact?
Yeah, and I'll say I was surprised by this. We were really surprised and disappointed by the food security issues that so many kids and families in the province were experiencing. When you have that kind of a base level human need, that puts in priority pretty quickly how that you then address your school, how you address your family functioning. That was was really prominent. We had thousands of Albertans, as you know, that either had reduced income or lost jobs. That impacts on the child's ability to learn, on their ability to develop, and we saw that was pretty prominent. That kids don't exist in a vacuum. That what happens to their family also happens to them, and so it's really important for us to hear that and understand that. And then through our recommendations, try and address how best to put some solutions in place for that. So that would be a couple examples that stand out.
Well, and I think just to add a little bit of follow-up, what we did here when it came to things like food security and access to mental health supports, it did echo what we heard, I would say, before this review started as well. Government did take steps to invest $53 million in mental health. Obviously, many of these organizations supporting young people and families in the community. Also, dollars were directed to support food security through food banks across the provinces and other organizations that step up to make sure that kids have lunch at school, for example. I know this obviously highlights some of the things that ministries had already heard and had already worked to address. And now this gives us an opportunity to look at where can we continue that work and how can we as different government ministries come together to support families when we know there are lots of programs and support services that do exist. How can we build on that? How can we build on the great work that's being done? and where are the gaps where we need to come together on our shared work. And so that's where I think there are some exciting things. Also, when it comes to learning loss, I know Minister LaGrange, who is not with us today, heard the call that children were struggling, young children. We know that if children don't know how to read by the time they're in grade 3, that can impact their success in future grades. That is why we invested $45 million to support learning loss for those children in grades 1 to 3, and those dollars rolled out this fall. That's something that we're going to continue to address, something that she's really passionate about, and I think it's really encouraging to see ministries come together like education, children's services, community and social services, health, mental health and addictions, and then work with our community partners who are doing much of this work in the community already. So I think it is positive in some ways that what we heard was what we had been hearing before, and it echoed some of the supports that we and actions that we had already started to put in place. But obviously, as Dr. Schwartz has said, there is always more to do, and this really gives us a blueprint to focus on as we move forward.
Operator, can you please put the next caller through?
Mary Noreen, Win Speaker.
Hello, Dr. Schwartz. You were talking about vulnerable groups. Can you tell me how Indigenous children were impacted?
Indigenous?
Indigenous.
Yeah, thanks for the question. On our panel, we had one of the treaty members, part of our group, and who has expertise in education and community development. One of the things, again, was, and we've addressed this in our recommendations too, was just so many things went online. But that didn't mean that every community, especially as we got into northern communities and into some of our First Nations communities, that they had reliable access to the internet. And so when it comes to learning, comes to seeking either health support or mental health supports, that was a big part of it. And of course, we know too that they responsibly some of the Indigenous communities quarantined heavily to make sure that their community members stayed safe and that there was, they reduced the risk. But in doing so, again, that cut them off from those social relationships and those inter-community activities that are so important to our Indigenous groups. And so yeah, those were the main things, and we really feel like there's again a unique opportunity here for us to again work with those communities. And I know that a lot of the Indigenous work is in First Nations is with federal government, but I know that again that's where the partnerships, that's where the communication has to happen amongst our leadership as well.
Thank you.
Yes, thank you. And I'd just like to add that one of the big learnings from hearing from the Indigenous stakeholders and children and youth directly was that current and future supports need to be delivered in culturally appropriate ways. And when you're talking about accessibility issues, they were more profound in rural and remote Alberta and on First Nations. So definitely something that we need to work on as a government. And as to the previous question, I just wanted to comment that not all children were severely impacted by the pandemic or pandemic-related health measures, but there were a significant portion of kids that perhaps had challenges before the pandemic, and those challenges were exacerbated by it. So there are a lot of areas, and Minister Schultz touched on education, and Dr. Kelly Schwartz talked on food security and the need for connectivity and devices to enable remote education and virtual mental health supports. So there's a lot of tangible recommendations here to make life better for our children and youth, and I look forward to working with the government. Thank you.
Sherry, did you have a follow-up?
Yes, I do, for Minister Schultz. I'm wondering, has money been set aside to address these recommendations? Is there a budget?
Well, and thank you. That's a very good question. So the recommendations, and I'm not sure if you've had a chance to look at them just yet, they're not necessarily specifically targeted, all of them, to one particular ministry. In our ministry, for example, when we look at things like the Family Resource Networks, we actually got a lot of great feedback on how that network is working, that there is a very real and purposeful connection to all of these supports that vulnerable kids and families may need, right? Without them having to pick up the phone and call 7 different organizations, which we know many families aren't going to do. And so we actually got a lot of positive feedback on how that network is working, even though it just really began at the beginning of the pandemic, at the beginning of April in 2020. But that was really positive, that we have cultural supports, culturally tailored supports, training for staff in our community organizations to make sure that they are offering supports in culturally appropriate ways, whether that is for Indigenous young people and their families or for newcomer families, for example. So there was really positive feedback when it comes to some of those specifics. When we look at things like, as Dr. Schwartz highlighted, some of the younger children, those that might be preschool aged, maybe not hitting their developmental milestones. Well, that I think speaks to the importance. And I'm not here to speak for Dr. Hinshaw, but I know she's said a lot that childcare centers and preschools have done an excellent job of keeping children safe. But they're also really important for kids to connect with each other and to learn and to develop and to work on their fine and gross motor skills and communication and interpersonal skills. So there was a lot of positive in there, and I think when we look at the expansion to the early learning and childcare program right across this province, that is going to have a huge impact on preschool age children and their families, and to address some of these very real concerns that we heard. And so, I would also say that one of the things we heard a lot, and the panelists also had the opportunity to meet with a number of different ministries to get an idea of what's being offered. We know what we heard. We know what we heard from parents, from young people. We know what we heard from community partners, and all of those people who are experts and work with children and young people and their families. Then they had an opportunity to say, okay, so what really exists here? And I think one of the things that came out loud and clear was that there are a lot of supports, especially when it comes to mental health supports. So how do we make sure that every community is served? How do we make sure that the materials or the connections are in the right place at the right time in a way that kids and young people and their parents are actually going to use them? Are there ways that we could tweak existing programs or work together across ministries with community partners to better address those needs? And so I think that there's a huge amount of opportunity. I know even so, talking about broadband and connectivity, that's something that Minister Golubish is working tirelessly on. And so as government works on our action plan, we're going to come together, take the time to get this right, to work across a number of different ministries, take a look at what's happening right now and where the mismatch might be, and then come back with an action plan. At that point, we'd probably be in a better position to talk about actual dollars that are needed here. So stay tuned for that in the new year, but that's an excellent question.
Operator, can you please put through the next caller?
Stephen Cook, CBC.
Hello. Thanks for taking my question. Talking about making an action plan, and this is for Minister Schultz, my apologies. You've got these recommendations after the panel was set up half a year ago, talking about this creating an action plan, but what's the timeline here for actually picking these up and putting them into action? We are on the second year of the pandemic. You've identified these problems kids are facing. How soon can they get the kind of help that this is recommending here?
Yeah, and that's a good question as well. Once again, I would reiterate that what we continued to hear over and over is that for some of the more vulnerable and at-risk children and youth, what the pandemic did was exacerbate or highlight gaps that already existed or struggles that these children and their families might have already been facing. And so, while a lot of this was really focused on the pandemic, it does give us an excellent opportunity to look at the supports that we have for kids and youth, to really address what they've been feeling and what we've been hearing across multiple ministries and again with community partners. So I would suggest that more to come in the new year. We want to make sure that we're doing this right and that we have an opportunity to work with a number of different ministries to not only make sure that we're not duplicating efforts, but that we're really actually taking a look at what currently exists and what are the areas that we need to do better. So that's not going to slow down the work. As I said, obviously, Minister LaGrange's example and investments of the $45 million to support learning loss, that's a great example of how government is going to take action right away to address some of these needs. I know, when we talk about mental health and addictions, the Minister of Mental Health and Addictions has been working on the youth hubs, additional treatment beds for mental health and addiction services, $53 million throughout the pandemic to address mental health supports so that kids and their families can access those supports when we need them. A lot of work is already happening right now, and so it's not going to slow down because we're also taking the time to make some bigger systemic change. I think that's pretty exciting, and I would suggest by the spring we'll have a much more detailed plan to release for all of Albertans to see.
Stephen, do you have a follow-up?
Yeah, this report is being released today. I imagine the office has sort of had a chance to look at early results. I mean, you say, there's these programs that already exist that are being or looking at expanding. You've received this report, so already things are on the move in terms of existing programs. That a lot of them, it seems like access may be a primary issue. Have there already been directives or orders put down? And could you even speak specifically to any that have gone out?
Yeah, and I think, just speaking more generally, I think as we gathered feedback across the last number of months and right across the province, we did provide that feedback to our colleagues, MLA Jones and I, as that work continued. And so, we had a good idea of the feedback we were getting, some of the gaps that may have existed so that we could take some of that quick action, but we really wanted to wait to see what the panel brought forward in their very specific recommendations before we reached out to the other ministries to come up with that action plan. So work is going to continue. As I said, work is already underway. In fact, even last week we had a number of our colleagues in a room with our experts talking about, okay, if we know, for example, that we need to create some community hubs, we need to address students and kids and families where they're at, how might we do that? What did we hear? How can we provide that feedback to some of the other ministries so that they can take that right now before other new programs are rolled out? I think that is a perfect example of how this is supposed to work, how we can take that feedback and take the knowledge of our expert panelists who, by the way, are just incredible, and we are so incredibly grateful that they lent us their time and their talent over the last number of months, and then use all that they know to make sure we're getting this right, and that it's not just a report that sits on somebody's desk and then we move on to the next thing. So that's certainly the last thing we'd want, and I think we're already seeing that work start to happen right now.
All right, that concludes our event. Thank you very much, everybody.